So good morning everyone. Today we will learn data analysis on independent sample t-test. So in this session, I will be talking on basic concepts of independent sample t-test followed by the research questions for which we need independent sample t-test to answer, underlying assumptions and hypothesis, the commands and its interpretation, and at the last, the summary of the session. Independent sample t-test is known as independent because there are two independent groups for which we want to compare the mean value of a continuous or a scale variable across these two independent groups. These could be the possible research questions for which we need independent sample t-test to answer. Like, one research question could be, is average BMI value of population with history of cardiovascular disease is different from population without history of cardiovascular disease? We can compare the pain score on visual analog scale after surgical technique 1 versus surgical technique 2. Do medical undergraduate students who have good quality of sleep score high in exam as compared to poor quality sleep? So in all these research questions, what have you observed? So you have seen that there is a continuous or scale variable in each research question and you want to compare mean of this across two categories of a nominal variable. So, what is the appropriate statistical test to answer such research question? So, you are right. It's independent sample t-test, also known as the unpaired t-test. Independent sample t-test is also known as student t-test, between subject t-test or unpaired t-test. So, we can apply independent sample t-test in three research design. The first is, if I want to compare the mean difference between two independent groups, like in this example, you can see that there are males and females, and if I want to compare the mean cholesterol level of male and female, then I will apply independent sample t-test. The second research design could be, if you want to test the mean difference between two interventions, like you can see in this example that there is an intervention group and there is a control group, and blood cholesterol level was measured after 6 weeks of exercise training program in both the groups. And if you want to compare the mean cholesterol level after this intervention in control versus intervention arm, then you can use independent sample t-test. The third research design could be, if you want to test the mean differences in the change score. Like in this example, there are two groups, intervention and control group, and cholesterol level is measured in the two groups before the intervention and after the intervention. And if you want to test the change in mean cholesterol level in both the groups, like you can see here, you can see the differences in pre and post intervention in both the groups, then you can apply independent sample t-test to test the mean differences in the change score across the two groups. There are few underlying assumptions which needs to be met if you want to apply independent sample t-test. The first assumption is, there should be one independent variable which is measured in a continuous scale. the one independent variable should have two categories, that is, it is a dichotomous variable. There should be independence of observation. That means if I want this assumption to be met, I should have two separate groups. If I have counted one person in one group, he will not be there in the second group. That we mean by the independence of observation, and this assumption needs to be met if I want to apply independent sample t-test. The fourth assumption is the dependent variable should be approximately normally distributed for each group of the independent variable. There are many ways to test normality in SPSS, for which you can see my separate video on normality testing, but most commonly we use Shapiro-Wilk test and quantile plot for testing normality in SPSS. Shapiro-Wilk test is used when the sample size is less than 50 and it is an objective way to test normality, whereas QQ plot is a subjective way to assess normality and it is used when the sample size is more than 50. When the sample size is more than 50. As the quantile plot, it is subjective in nature because you have to visualize the plot for taking the decision. So it is used when the sample size is more than 50. Independent sample t-test is a robust test. Therefore, we say that even if the data is approximately normally distributed, we can use this test. And thanks to the central limit theorem, because of which if you increase the sample size, even the non-normal data, it starts behaving like normal, and then you can apply the independent sample t-test. If the data is not normally distributed, but if you see the distribution and if the direction of the distribution is same in both the groups, that means it is positively or negatively skewed in both the groups, then this test can be applied. The next underlying assumption is that there should be no significant outlier in the two groups of the independent variable in terms of the dependent variable. Now let's understand the concept of outlier. We define outlier any data point that are more than 1.5 box length from the edge of their box, and they are classified as a dot, and this is known as outlier. Whereas data points that are more than 3 box length away from the edge of their box are classified as extreme outlier, and it is represented asterisk. So you can see that this is an extreme outlier, whereas this is a normal outlier. The three most common reasons for outliers are: it can be a data entry error, it can be a measurement error, or it could be a genuinely unusual value. So how to deal with this outlier? One very common way to tackle outlier is, if they are few in numbers, you can report the outlier or you can remove the outlier. The most important is, whatever you are doing, just mention that in your manuscript. If you do not want to remove outlier, then one alternative is to use a non-parametric analog, that is the Mann-Whitney U-test. You can modify this outlier with one, that is Lex extreme value, or you can transform the dependent variable, or again one very common option is to include the outlier in your analysis, run the analysis, but do report them in your statistical analysis plan. The sixth assumption for independent sample t-test is that homogeneity of variance should be there in the two groups. That means the variance in each group should be equal. Now let's understand this concept of variance. The variance is tested using Levine's test for equality of variance. This assumption states that variance in both the population from where the samples have been selected, that should be equal. So Levine test tests whether the two samples which we have drawn, have they come from the population with the same variance or not. So based on the assumption of Levine's test, two types of independent t statistics. The first statistics is using the assumption of equal variance, and if the assumption of equal variance is met, then you should use standard independent sample t-test statistics, its degree of freedom and p-value. If this assumption of equal variance is not met, then you should use Welch t statistics, its degree of freedom and p-value. So the null hypothesis for independent sample t-test is the population mean of the two groups are equal, and the alternate hypothesis is that the population mean of the two groups are not equal. Let's learn this in Jamovi. So the objective of this analysis is that I have to check the difference in the mean systolic blood pressure, mean diastolic blood pressure and mean total protein in patients who have the first episode of myocardial infarction compared to those who have a recurrent attack. So the codes which are there in the Excel sheet, that is the MI category, 1 is for the first attack, 2 is for the recurrent attack. Similarly, gender, 1 is for female, 2 is for male. Race has been categorized as 1 as white, 2 black and 3 others. BMI has been categorized as 1 normal, 2 overweight and 3 obese. And socioeconomic status, 1 low, 2 middle and 3 high. The other variables like systolic blood pressure, diastolic blood pressure, total protein and cholesterol and age, they are the continuous variable. So now let's import the data in Jamovi. So open Jamovi. It will take some time to open. Then click on this. Click on open, browse and then give it this path, the link to this Excel sheet. So this Excel sheet has been saved in my PC. So I have given this, click and then open. So once you click this, this will open in your Jamovi. Now again, like you did for the previous sessions, here also you have to go to the variable and edit it. So this ID is a ID and this is not in text, so this will be an integer. Then again go next. This age is a continuous variable and it is in completed years, so it will be integer. Then gender is a nominal variable but it is integer. You can give 1 for female and 2 for male like we did. Similarly, this race is nominal, again this is integer. So similarly you can label this race, SCS is nominal, it is again a integer, that 1, 2, 3 that we have seen the code, you can put those code here. And then this BMI category, that is also nominal. I have changed it to integer. You can put like no, you can put like normal, overweight and obese. And in MI order also it is a nominal and this is integer. So you can put here 1 as a first attack because this is a research question, that's why I am labeling it. and this is the recurrent attack. Systolic blood pressure is a continuous variable, and it is again not in decimal. This is continuous, but continuous it's better that you keep decimal. So this also I'm changing as decimal. DBP is a continuous variable. Total protein is again continuous variable. Cholesterol is again continuous variable. And that's it. So you have changed this variable. Now you have to go to the data. You can see the data here. Now go to this analysis. Click this analysis. You can see here t-test. So if you click this t-test, you will see three options: independent t-test, paired sample t-test, and one sample t-test. Now we have to do independent sample t-test. So there are certain underlying assumptions that we have read now. What are those underlying assumptions? The first assumption is the dependent variable should be a continuous variable, and it should be tested across the two categories. So click this. Now dependent variable. So the dependent variable in this case, it is the systolic blood pressure, diastolic blood pressure, and total protein. So I have selected all these three. Move to this box of dependent variable, and then there is an option of grouping variable. So this grouping variable is the MI order in my research question. So I have moved this grouping variable to this column. Now there are various options you can see here. So this is the student t-test, which is already clicked here, but click this Welsh t statistics also, because we know that if the homogeneity of variance assumption is not met, then we have to take this Welsh t statistics value. Click on descriptive, because you need to know the mean of both the groups along with the standard deviation. And in assumption check, I have to check for the homogeneity and then normality. And then you can see here. So first you see the normality and homogeneity, because that will tell you whether you can use the student t-test or not. So normality here in this case, you can see the value of Shapiro-Wilk. So if the value of Shapiro-Wilk, it is more than 0.05, if this p-value is more than 0.05, that means that the data is normally distributed. In this case, you can see that the systolic blood pressure, the p-value is more than 0.05, whereas in case of diastolic blood pressure and total protein, it is less than 0.05. So these two are not normally distributed, but systolic blood pressure is normally distributed. But we know that the independent sample t-test is a robust test, and slight deviation it can tolerate. And in this case the sample size is very large, it is 193. So you can still apply this independent sample t-test. So I have I will report this about the normality. And one more thing about the Shapiro-Wilk test, that generally the Shapiro-Wilk test is useful in case of a sample size less than 50. So since here the sample size is more than 50, so it's preferable to use this QQ plot. So if you click this option of QQ plot, you can see here that there will be appearance of a plot, and if that data point it is across this diagonal line, that means this is normally distributed. So you can see the systolic blood pressure, it is normal, DPB also normal, and this is also normally distributed. So this QQ plot shows that the data is normally distributed. All these three data, the systolic blood pressure, diastolic blood pressure, and total protein. So it's preferable, if the sample size is more than 50, it is preferable to use QQ plot and not the Shapiro-Wilk test. So that's why I'm unchecking this, and I'll use this QQ plot for my reporting. Then you can go and see the descriptive. So this descriptive, you can see here that the mean in this case, first attack is 147. In second attack, the mean SBP was low. And you can see the value of standard deviation also. Similarly, the diastolic blood pressure, it was more in case of a first attack and less in case of a second attack. And you can see here the value of, so now see this Levine statistics. So you can see here that the value of Levine statistics, all these three, these are more than 0.05. So if the p-value for Levine statistics is more than 0.05, this assumption is met. And if this assumption is met, then we have to use the student t-test, not the Welch t statistics. So then what I'll do, you go up and you have to use now this student t statistics, its degree of freedom and p-value. Similarly for diastolic blood pressure also, you have to use this. So I'll be taking these values since the homogeneity of variance is met. So I'll take this value, and this value. So now how to report this? So this is the table. You can enter these values here. So this is a single table. You can see the MI status and the mean systolic and diastolic blood pressure. Similarly, the interpretation we will like that there were 133 cases of first order MI and 60 cases of recurrent MI. The mean SBP across MI was normally distributed as reported by the visual inspection of QQ plot to test for normality. So you have to write the assumptions also. So you can write the interpretation like there were 133 cases of first order MI and 60 cases of recurrent MI. The mean systolic blood pressure across MI was normally distributed as reported by the visual inspection of QQ plot to test for normality. Independent sample t-test was run to determine if there were difference in the SBP between first and recurrent MI, and there was a homogeneity of variance as assessed by the Levine test of equality of variance, and you have to give the p-value. And it was observed that there was a significant difference in the mean SBP of patients having first episode of MI versus patient having recurrent episode of MI, giving its p-value. So this is how we write the interpretation. You have to write the assumptions. You have to also mention regarding the homogeneity of variance. So if you club all these three values in single table, then you can again write, you can see the first and recurrent episode of MI, you can write the descriptives, that is the mean and SD, and then in here in the third column you can write the t value, the degree of freedom and the p value, and similarly you can write the interpretation. So you have to again report the visual inspection of QQ plot, and you have to write the value for the homogeneity of variance. So in this case you can see that the homogeneity of variance is again, it was met because the p value was more than 0.05, and then you have to report the descriptives. So similarly you have to write the interpretation for number of variables which you have included in your analysis.